سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to MTV. Our program ongoing is health and lifestyle. We'll look at different topics as we build up from the time a child is born till the time we become our parents ourselves and all the problems we face in between. This session I'd like to cover two things. One of the two extremes of problems encountered when a child is passing stool and is not passing stool. So both what could be considered constipation and what could be considered diarrhea. We'll look at the normal patterns of passing stool first before we discuss the abnormal patterns, so it gives a little bit of a clearer picture on what's happening. When we come back to newborn babies, for newborn babies, they're a slightly unique group of people just because of the number of times they pass out stool, and as they get older, how the changes are expected to occur. So when we consider the normal pattern of passing stool in a newborn, one who's on exclusive breastfeeding, the normal pattern you'll be told is generally they might pass no stool in one day to as many as up to 8 to 10 times passing stool is considered normal for a newborn. The caution there is that if there's any blood in that stool, there's a problem. The normal color of that stool will vary anything between brown, yellow, light brown, green. Those are the general pattern of colors that will usually change. Only get concerned with that stool pattern if you see colors like black, white, and red. Now it's time to get concerned. Each of those three colors means a danger sign. Get your child's stool checked out and your child checked immediately if you see any of those three colors in stool. So those pattern of stool is for a child who's exclusively breastfed. For children who are not exclusively breastfed and say now end up being on formula for whatever reason, either the mother did not have enough milk or the mother doesn't have any milk, the pattern of stool will change. It may reduce to as little as nothing in a day to just about 3 to 4 times a day. So breastfeeding in neonates usually pass more stool than those who are not being exclusively breastfed. As we get older, the pattern of passing stool will generally change based on what the diet is weaned with. So when a child is given more of the starches, the amount of stool they produce in a day will probably reduce in frequency. If they're given a little bit more fruit, chances are they'll pass out more stool than a child who does not pass, who's taking more starch. The thing is, as they get older, that times in a child's life where they're expected to have problems with passing stool because it's a transition from one phase of life to another. So a child who's right now on diapers or nappies alone, who then has to change and is potty trained, during the period of potty training, they will have problems transitioning from one phase to another. So you might notice a drop in stool production just because they're getting confused. So for such children, the learning how to pass stool is not an automatic process. They need to be trained on how to use that potty, and it might mean sitting that child down on that potty as many as 3 to 4 times a day until they learn that yes, now I can no longer need my nappy, I can start using the potty. When you transfer them from the potty to the main toilet, that's another phase in their lives where a little bit of confusion arises, and they have to be taught that using the toilet seat is a little bit different as compared to using the potty. If you by any chance have any of the toilets for squatting in the house, they are probably better than the toilet seat because it's less confusing for a child. Since they were squatting on the potty, they just continue squatting in the main toilet. The next time the child gets a little bit confused and can have problems with passing stool is when they start school. When they're at home, they can use the potty or the toilet anytime they choose. The moment they go to school, timings are controlled. Teachers will tell them, no, you can't go now, you have to wait. Wait until the next break, we take all of you. The moment they want to use the toilet in school, There are like maybe 5 or 6 other children behind them. Hurry up, hurry up, hurry up. We all need to go. So the teacher is hurrying them up in that process. That's another period when you might find that now there's a complete change in the number of times they pass stool, and they might start holding that stool just because they don't want to use school toilets, and they wait until they get home before they pass out stool again. Those are some of the periods when you might have confusion. As they get older, towards the age of about 5 years and older, again the patterns will change because now they're in a hurry to go and play. So they want to come in, quickly use the toilet, run out, go and play again. So which means they never empty everything that they collect. That's another stage where you'll be told, Mom, I went twice, I went thrice, but they've never emptied everything out. It's another stage when they'll end up getting a bit of problems passing stool. And the next time they end up passing stool usually is if your child goes, say, from a day school to a boarding school. Chances are in boarding school they will have trouble again. Just because the same thing happens, there are like 20, 30 children in that same dormitory. Each of them is using the toilet probably first thing in the morning that they wake up, or just before they go to sleep in the evening. So your child might actually face problems again during that point in time. So the strict definition of what we would call not passing stool well or constipation might vary from age group to age group, but in general, it's a child who passes very hard stool, maybe in very large amounts, infrequently, less than maybe 2 or 3 times a week. That would be considered the general definition of constipation for most children, and they usually strain at passing out stool. For the younger babies who are below the age of 1.5 years, it might mean that every time they need to pass out some of that stool, it's small hard pellets, and they really scream and cry and strain as they pass out that stool. That's a warning sign that yes, this is a child who might be suffering from constipation, and they keep on passing out a lot of wind, and you notice that that stomach looks a little bit swollen and it's almost always full of gas. Those are some of the children who can actually have trouble in that age group. As some of the solutions surrounding that, for the newborn babies, they might not be a very good solution. It might just mean sometimes massaging the abdomen or getting them to help them pass out that stool. You squeeze a little bit and it may help them. Time to time, you may have to seek medical care where they may need a little bit of laxatives or something to soften the stool to get it out. For most of the children who are now from the age of the time they're using potty training till the time they're going to school, majority of them, it's about training them to use the toilet well to avoid that problem. It's not an automatic process. Please don't let your child do it themselves initially. Train them to empty that stool out, simply because if you do not and persistent problems with stooling occur, it does tend to become a long-term process and a problem later in life. So some of the problems that they can face now are urine infections. And interestingly enough, passing urine, passing stool tend to go hand in hand. So if a child is persistently having constipation and hard stool, they're more at risk of getting problems with urine infections later on. Does that play a role in constipation? Definitely it does. Giving your child all the greens and vegetables, all the fruits, is important. A lot of the times we give them juice instead of the fresh fruit. Preferably give them the whole fruit. That part of the fruit we blend and we throw away is all the roughage in the fruit. That is necessary for a child to pass out stool. It tends to soften stool. It tends to give a little bit of bulk to that stool so it can actually empty a lot easily. Same thing with vegetables. Don't tell them, no, you don't have to eat this if you don't want it. Have more meat, have more starches like potatoes, carrot, all that. Please insist your child completes all the vegetables that you provide for them. Should raw vegetables be eaten versus boiled or steamed or cooked vegetables? There isn't that much of a difference. So say, for example, things like carrots. Those can be eaten boiled, those can be eaten raw. They probably have the same amount of roughage at each point. Things like the salads, introduce them early into their diets. Boiled cabbages, any of the legumes, all of them have roughage. Introduce them at a very early age. The spinach, the sukuma wikis, give them early. Your child will choose what they want to eat and say, I'm not eating this, I don't like it. Preferably don't give them an option. Insist that they eat it. simply because it makes their work a lot easier. We come back to now children who are a little bit older and who are going to school. How can you train them to avoid getting into problems during this period in life? The best way to do it is before your child leaves for school in the morning, get them to sit on the toilet, try and empty everything out. When they come back from school, get them to sit on the toilet again. So in between, during the school sessions, if they did not use the school toilets because they were afraid or they were in a hurry, when they come home, they have been given the same amount of time to sit on the toilet, try and empty everything out again. So which means minimum 2 to 3 times a day. Train your child to use that toilet such that it becomes a habit. And as that habit continues, it becomes easier and easier for your child to pass out stool. There's sometimes when, despite doing all that, your child still develops constipation and complains that the stomach is paining. When they went to pass out stool, they saw a little bit of blood in stool. That's about the time get them seen by the nearest doctor. The reason being is that stool so much now that they cannot remove it. Do they need help in removing some of those products? So it actually becomes now the healthcare provider's job to guide you on which medications to use. There are multiple products on the market. Preferably do not walk into a chemist and buy them over the counter, simply because some of those products may not work and might cause harm. They have to be used for very specific types of that hard stool. So just before we take a break, I'd just like to summarize what I've talked about in the last 10 or 15 minutes. We've looked at the difficulties in passing stool at the different stages of life, and each of those stages, how it's possible to prevent some of those problems in your children. We'll take a short break and come back again and continue with this topic. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back from the break. Just to remind you what we're looking at the different problems when it comes to passing stool in children. Just before the break, we tackled problems regarding not passing stool very well, more commonly referred to as hard stool or constipation. The second half, I'd like to look at things, what we call diarrhea, and some of the different types of problems and diseases we might encounter when we talk about diarrhea. So in terms of defining what diarrhea is, it's been given a general consensus worldwide that diarrhea refers to passing more than 3 amounts of loose watery stool in a duration of 24 hours, which is not in normal keeping with the child's passing of stool. And generally, if it's being collected in a container, it's thought to take the shape of the container, implying how watery it actually is at that point in time. The different causes of diarrhea in children, some of them may be caused by infections, some of them may be caused by other problems regarding digestion in the child. So we look at, say, for example, problems regarding the different types of infections that children have. There are multiple things that can cause infections in a child. So from the bacterial infections to the viral infections to sometimes the fungal infections, even the parasites can actually cause diarrhea in a child. If I look at in terms of the most common things that children have, so below the age of about 3 years, most of the causes of diarrhea are probably the viruses that have been implicated. And that's one of the reasons why when you walk into hospital and somebody tells you, I'm just going to test the stool, and you'll be told there's something I'm looking for called rotavirus adenovirus. Those are probably the 2 most common culprits for diarrhea in a child below the age of 3 years. Now, the sad part about being told that this is caused by rotavirus adenovirus is we cannot treat it. It's a virus, so the body has to fight it, the body has to get rid of it. So the most important thing in that age group primarily becomes keeping your child from getting dehydrated. So say, for example, if your child has had about 6 to 7 episodes of diarrhea in that span of the last maybe 12 to 24 hours, you have to keep on giving your child more fluid to replenish whatever they're losing. One of the most important things to use in a fight against getting a child dehydrated is probably the oral rehydration salts. Far more important than any other medicine your child is ever going to get. What it does is when you walk into the chemist, there's usually a sachet they'll give you with the powder. That's the oral rehydration salt. Add it to the water, be it half a liter, 1 liter as indicated on that sachet. give your child to drink that more frequently. So for every time the child has a bout of diarrhea or the loose stool, try and roughly give the same quantity that your child has lost from that diarrhea to replenish whatever they're losing. So it's putting salt because it contains salt. It has a bit of sugar, which means gives your child some energy, plus water, which your child is now taking back. So in the end, you're not getting a child who's dehydrated, and as the body fights and repairs everything as the process goes on, the child is prevented from getting dehydrated. The things to watch out for in such children when they're having the diarrhea, now this could apply to all across all the age groups in most of the children, is how many episodes of diarrhea has a child had? Bear in mind that very often diarrhea rarely comes on its own. It's usually combined with vomiting. So if your child is vomiting, has your child had more than about 6 to 8 episodes of vomiting in a span of 5 to 6 hours? Or every time your child takes something to drink, does your child end up vomiting 1 or 2 seconds later? If your child is doing that, that's an early warning sign. Go to hospital, get seen. If you notice in a span of about 6 to 8 hours, your child has already had 8 to 10 episodes of diarrhea, time to get concerned. Seek help at the nearest health center, simply because those are very many episodes of diarrhea. A younger child is likely to dehydrate far faster than an older child above the age of about 10 years. But it's still a warning sign. Get your child to hospital. More often than not, when you get to hospital, there are a couple of questions you'll be asked. One, how many episodes of diarrhea or vomiting? Has the child been having a fever? Did you notice any blood in that stool? Those are some of the common questions you're going to be asked. Did your child eat anything different in the last 1 or 2 days? Anyone else in the family who's been affected by diarrhea, vomiting? Those are some of the problems you've got to watch out for. I think currently in the country, we are having what we've been calling an amoebic dysentery outbreak. So amoebiasis is slightly unique. That's one of the parasites I was telling you that's involved, rather than now bacteria and fungi. That will actually, the reason why we call it dysentery. So dysentery is a very unique term for diarrhea where you see blood in that stool. That's what we consider dysentery. And very often your child will look very sick, might have very high fevers. That's the time you rush to hospital. The second time you rush to hospital, if your child looks unusually sleepy, not the normal, they want to sleep all the time, yet on a normal day they're running and playing, and they've been having diarrhea or vomiting, that's a warning sign. Go to hospital quickly. Your child is getting dehydrated quite fast. For some of the smaller children, especially the children below the age of 1.5 years, when you think your child is in danger, some of the things you can look out for at home yourself before you rush to hospital is if your child is breastfeeding and they reduce breastfeeding, go to hospital straight away. If you'd been giving you notice that the diaper change is reduced, maybe on a normal day you're changing 4 to 6 diapers with urine. Now suddenly it's just 1 or 2 diapers of urine. Time to get worried. Rush to hospital straight away. That's a danger sign. When the tiny ones, you'll notice that the eyes, usually the eyes should be staring out. If they look like they're sinking inside, so the eyeball looks like it's going inside, rush to hospital straight away. That's a child who's in danger. He's almost getting severely dehydrated. Get seen, get help immediately. When we come to the older children, some of them tend to suffer diarrhea in between just because they've eaten something different. So if, say for example, they were out yesterday, they had chips in a restaurant and you came home and your child starts having diarrhea, vomiting, it's not necessarily a sign that you must rush to hospital. These are older children, probably above the age of 5 years. If they can drink oral rehydration salts, they can take enough plain water, they can take fruits, they can take things like yogurt and other drinks like soup, uji. Give them more fluid in their diet. Very likely you may not have to go to hospital, and if it's food poisoning, on average, it sorts itself out in about 1 to 2 days. The child is back to normal. Give a lot more fluid in that period of time. For most children, majority of them, when they get things like the diarrhea, vomiting on average lasts for about 3 to 5 days. Diarrhea can go from 5 to 7 days on a normal basis. There are exceptions where it can reach 2 weeks for diarrhea. There are exceptions when the vomiting may reach more than 7 days. Those are all signs that something else is going on and your child needs to be brought to hospital for a checkup. There are times when we get questions from mothers that I noticed my child had some loose stool. It had a lot of mucus. Do I need to worry about an infection? Should I come to hospital and get the stool tested? Not necessarily do you have to rush to hospital at any given point in time. Just because there's a bit of mucus and the stool was soft once or twice does not mean that your child has diarrhea. It could just mean on that specific day, your child passed either stool more frequently, passed stool less frequently, and had a bit of trouble in between. The main danger signs are your child is vomiting every single thing and can keep nothing inside. Your child has had more than, say, 8 to 10 episodes of diarrhea in a span of 5 to 6 hours. Your child has refused to eat or drink anything when you give them. And your child looks unusually dull and tired. Time to get worried, especially for the older children. The younger children below the age of 1.5 years, your most sensitive marker is diaper changes. Have they reduced? If they have reduced, rush to hospital straight away. We also get a lot of questions sometimes, can worms cause my child to have diarrhea and vomiting? Because there are a lot of worms out there that are present. So we have the hookworms, the tapeworms, the ringworms, multiple different types of worms that are actually out there. Can they cause diarrhea? Can they cause vomiting? Strictly speaking, they do not cause diarrhea as such. But you may have sometimes hard stool being formed time to time because they interfere with the way the intestines work. So you might notice that these are times when one day a child has very hard stool, the days when it might be very soft, the child keeps on complaining of abdominal pain. Those are some of the things you've got to watch out for. Then there's one unique worm which is known as the pinworm. That's a worm that's very interesting. It sits just around the anal opening where stool should be passing out. It's extremely itchy. And the itching generally gets worse at night and early morning for a child. So you find a child wakes up and wants to itch. And it's very specific around the anal opening area. That's one of the worms that is notorious for causing that kind of itching. Best solution is you deworm your children. When you start deworming, we prefer or we recommend that you start about the age of 2 years onwards. Less than 2 years, unless you have proven that there are worms found in that stool, try and avoid deworming your children that frequently. Some of those medicines may have side effects below the age of 2 years. Try and avoid using them if you can. For the older children, then, how frequently should you deworm your children? Once a year is more than adequate for most children. It tends to keep them quite safe. If you're in an area where a lot of children are having worms frequently, then you may do it twice a year. But never do it more frequently than 6 months apart. Always allow a break of about 6 months before you actually end up deworming your children. So just to quickly summarize what we've looked at in the last roughly half an hour, we looked at initially children with hard stool and the problems they face with hard stool, and then problems with diarrhea and what to consider and the danger signs to look out for when your child is having diarrhea. I'd like to end this session here. If you have any questions, please hold them. We can always look at them in another session. Assalamu alaikum wa rahmatullahi wa barakatuh.